Good afternoon. Welcome to Return to Work. How has COVID-19 changed the workplace? I am Janelle Boyd with the NC Chamber. On behalf of the NC Chamber, we'd like to thank Ecolab for sponsoring today's event. All attendees are muted to avoid any distractions during today's presentation. If time permits, we will answer as many questions as possible at the end of the presentation. If you would like to submit a question during the meeting, please use the question and answer box. Please do not use the chat box. The recording of today's webinar will be made available to you within 24 hours of the webinar on social media and in the member newsletter. Now, I would like to introduce Adam Johnson from Ecolab. Adam is the Vice President and General Manager of the Global Food Retail Services Division of Ecolab. In this capacity, he leads the Ecolab retail platform globally, which works to provide solutions that help retailers run cleaner stores and provide safe food. Prior to his current role, Adam was the Vice President of Global Food Safety and U.S. Field Operations for the Quick Service Restaurant Division of Ecolab. In this position, he led Ecolab's food safety efforts globally to include the expansion of audit services and digital food safety. Adam, the floor is yours.
Thank you so much, and appreciate the opportunity to address this group and to partner with the Chamber on, this exciting and it's sometimes confusing opportunity of the reopening. And I use the quotes here for us from our perspective in that, for lots of components of the Ecolab business, we've been open all the time. For other segments, we have been closed, and obviously from a customer base, it's been an evolving challenge to navigate the pandemic. But again, a pleasure to be with you all today to have this conversation. Look forward to sharing some information, but also to the Q&A at the end. So next slide. Okay. So again, Adam Johnson, I'm coming to you live from our Greensboro campus in Greensboro, North Carolina. This is a picture of our office building, and tied to it is a fairly good-sized manufacturing facility. We have the pleasure of having several sites here in North Carolina. I'm proud to call it home for both our food retail division as well as our quick service division, here in North Carolina. So again, really excited to be here. Go ahead, next slide. So I wanted to just really start off, our portion of this to really talk a little bit real quickly about Ecolab's COVID-19 response and really focusing in on three buckets, right? Our people, our supply chain component, as well as our partnerships across the globe, right? As a people-first organization, we focused heavily on making sure that we looked after our people, both our field sales associates, 40,000 plus in the U.S., that call on all of the many customers that we look after, but also our manufacturing components as well, right? Making sure that we had business continuity, that we were up and running, producing those critical SKUs and supplies needed to combat the pandemic, whether that was in the healthcare setting or particularly in my space, in the food retail space, to make sure that retailers, like Walmart, Kroger, Sam's Club, et cetera, had the critical cleaning supplies and hygiene supplies necessary to maintain business continuity. So we had a lot of focus on looking after our people. And again, I won't go through all of the items that are on the slide, but quite a comprehensive approach to protecting our people, and probably an even more complicated response in our supply chain response. I know supply chain is a challenging topic these days across many aspects of business, but I would say during COVID, particularly the early days of COVID, when our customers needed us most, we really had to pivot and add additional capacity. We were creative about how we brought new products to market, not necessarily even from a volume perspective, but from an efficacy perspective, making sure that we had the right products in the right spot that did the right job and did it in a safe and sustainable manner, right? Clearly Ecolab has a long history of being a leader in the cleaning, sanitation, and hygiene space, and we weren't going to sacrifice, any of that credibility from a product standpoint, with a rush to put products on the market. And then obviously partnering as well, right? We've made many donations across across our customer base, whether it's in product or in dollars, to help look after the restaurant community, the retail community, and really, leverage our scientific expertise to help the COVID-19 response. Again, with research dollars, federal collaboration, local government collaboration, again, to make sure that we have the right products and the right programs in place to keep businesses open and to keep the public safe. Go ahead to the next slide. And when we talk specifically about our return to work strategy, it varies, and it's an informed approach. I've got a couple of dates here on the screen, and we know that every organization is taking a slightly different approach to this based on the levers that they have available to them and what matters most to their operation and their associate base. But for us, we are back in the office now at 50% capacity. We continue to welcome volunteers back to work in our offices. Obviously, the manufacturing facilities are at full capacity and then some. And we'll talk a little bit about some of the labor challenges we're facing, as I know many of you are as well. But we are currently at 50% capacity across our office spaces, and you can see the various campuses we have there across the U.S. And we're not going to have our full return to office until mid to late September. And again, a lot of that obviously, varies on factors of, vaccination rates, case incident rates, state-specific mandates, and, probably more importantly, where our associates are from a support perspective, right? Specifically around childcare. We've seen a lot of our associates that have gotten they've gotten good routines in their work from home strategies, and they've been very effective. And so we want to be very mindful of how we repatriate them back to the office space. So this just gives you a little bit of a flavor for how we're approaching our return to office strategy. Next slide. And again, as I mentioned, everyone will have to kind of, reflect on their own situation. This was really our rationale. Again, we'll go through all of these things, but really looking at, what is the level of vaccination? What is the phase of the pandemic? And we've obviously got classification phases internally on how we're looking at that, not just, obviously in the U.S., but globally as well. But these are some of the significant waypoints that we've baked into our rationale for fall return that we think are science-based, well-founded, but, obviously subject to change as again, this situation continues to evolve and we continue to get, updated guidance from, CDC, WHO, et cetera. Next slide. And again, these are some of the factors when we think about returning to normal. Obviously, it's the pandemic status, first and foremost, the reopening status, and we've got some slides here later on to talk a little bit about that. Consumer sentiment is a big one that we're focused on, specifically how that affects our customers, right? So what our customers are saying about what they would like to see, what they expect to see, and how that affects when they return to normal. And then I'd say most interestingly and most lately, the labor challenge, right? We know that that's a real issue that not only we're facing, right, from a manufacturing perspective, but also what our customers are facing and how we can help with some solutions around that to maybe ease some of the labor constraint to get our industries back to normal. Next slide. And again, this slide changes almost daily, it seems like. But again, you can see from this infographic, the majority of restaurants are operating with some dining capacity. Again, that varies from state to state, and in some instances from county to county or municipality to municipality. But we are seeing more and more states reopen and bring back that dine-in experience. Next slide. And we're also, really focused on understanding what, the consumer behaviors are going to look like as it relates to travel and leisure. That's another big segment for Ecolab, and obviously for several of you that are on the webinar today. But we do see that consumers are planning summer travel. I'm not sure how many of you have been on a plane or in an airport these days, but those of you that have, I'm sure would agree with me that they're fuller than maybe some would have thought they would have been. So people are definitely getting out and are starting their spring and summer travel. But there's also some sentiment that, that the economy won't fully recover until fall or later, right? So again, these are some of the research numbers that we're seeing that are out there. There's new numbers that come out every day, but we are optimistic as particularly the summer travel season kicks off that we will see more and more more and more volume and more business in our customer locations. Next slide. And again, this is I'd say maybe another view of really looking at projected travel in 2021. Clearly, we expect it to be up versus 2020, not a huge surprise. And again, I think those trends are already starting to materialize, where we see that in not only the airline segment, but the hospitality segment. So very encouraging signs for that industry that's been so touched by the pandemic and the shutdowns and the lack of travel. Next slide. And so we also know that COVID is going to leave a lasting impression, right? I think as we turn the corner on this pandemic, we know that view may be variable depending on where you are, but we know that post-vaccine consumer confidence is going to be an issue for the majority of the segments that we serve. Again, whether it's hospitality, food retail, quick service restaurants, full service, education space, the cruise industry, right? And again, I won't run through all these numbers, but you can see there that, consumers are still going to be worried about travel, and they're going to be worried about exposures, right? So, and I'd say most interestingly is that, consumers believe that there will be another pandemic, right? I think this has really shaken people at a deep level, and I think people are worried that this will either continue, or that it definitely had happened once, it can happen again, and it's more likely to happen in the near term. So we have to be ready. We have to continue to stay diligent with a lot of the activities that have emerged during COVID. Next slide. And there are ways, right? And so again, when we go out and do research on the consumer market, again, there's a large percent, if not even the majority, want to see more cleaning and more visible sanitation practices, even after the vaccine's distributed. Historically, a lot of the, cleaning, sanitation, and hygiene activities were really downplayed in the industry. You didn't really want to see people cleaning; you just wanted it to be clean. What we're hearing from consumers today is they want to see people cleaning. They want that activity because it allows them to know that the surfaces were cleaned or that the surfaces were disinfected. So again, I think it's important to understand what the end consumer is expecting, right? So again, it's those high touch objects. You've got items like hand sanitizer, where they still want that provided. So clearly, we saw a huge demand for hand sanitizer and hand hygiene products during the early part of the pandemic. That has diminished, but consumers still expect it to be available, right? And I think interestingly for us too, even outside of the hospital grade, component, which again I think is an interesting aspect where consumers want to see credibility in the space. Again, during COVID, there were a lot of solutions that were brought to the market that may not have been fully vetted or had the right amount of due diligence from an efficacy standpoint, but consumers want legitimate products that have hospital grade application, because again, that resonates in the healthcare space and obviously is very, very relevant to the pandemic. But probably the most interesting thing to me is they want some type of validation, right? They want this audit component. They want third parties. They want independent, objective validation that facilities are following through on their commitments, on protocols, right? And whether that's obviously clearly regulatory agencies play a role there, but we know that there are capacities and constraint issues when it comes to regulatory inspections. And so they want that bridged with some kind of independent audit component, again, to help them make an informed choice as to whether or not, the hotel that they're staying in or the school that their child is attending, that they have the right protocols and programs in place to keep everyone safe and healthy. Next slide. And so from an Ecolab perspective, we really reflected on kind of this consumer research and where our customers were going and really the hurt that our customers were under. And so we went out and got a lot of the team together, a lot of market research, spoke to a lot of our customer bases. What do you need to help ensure that you can communicate all that you're doing, all that you're investing, to make sure that your consumers feel good about coming back to your facility? And they said, well, we really need some kind of independent brand, some kind of independent program that can help speak directly to the consumer. And so we created the Ecolab Science Certified program, which is really designed to bring kind of these 4 buckets together to help, again, facilities take credit, for lack of a better phrase, for all of the work that they're doing to deliver a safe and healthy environment, right? We want our customers to be able to create clean, right? They need the right products and programs to actually get the cleaning, sanitation, hygiene, disinfection done. We want that audit component in place so that you can check that clean, right? That independent audit that I just referenced earlier that we know is so important to consumer confidence. They want that validation. But then you've got to give the customer an ability to see that and know that. So we created a seal, right, that can be placed on the door, certificates that can be hung in the facility that, again, help message to the consumer, the direct consumer, that this facility has taken, additional steps to create a safe and healthy environment. And then we want them to believe that, right? We've got to invest in the Ecolab brand to make sure that the consuming public, links the Ecolab science certified logo and brand with all of the legacy history and proficiency that Ecolab has in this space of ensuring food safety, ensuring hygiene, ensuring public health across a multitude of segments of the industry, again, whether that's healthcare, food and beverage, hospitality. So really, again, trying to create this program that our customers can leverage to really speak directly to their consumers. Next slide. And just to kind of unpack it a little bit more on the create and check clean, because I think these are interesting components. Again, it's really focused for us and why we chose the name Science Certified. Clearly during COVID, there was a lot of discussion, let's call that, around science and what did the science say and what was it directing us to? And Ecolab, as being a science-based organization at its core, right, research and development, hundreds of patents, very focused on innovation and development, wanted to have science-backed programs that were comprehensive and proven effective against COVID-19 and other variants, if you will, while not forgetting about the day-to-day risks that still exist, right? I would say that, the challenge for us from a food safety and public health space is, even with all the focus on COVID-19, yeah, salmonella is still an issue, E. coli is still an issue, norovirus is still an issue, right? None of those things really went away. They just didn't have the headlines. So we want to make that science-backed program. We wanted to make sure that they could use those programs in the right way. And I think this has really been exacerbated by the labor challenge. We have so many people disrupted in the workforce, losing jobs, taking new jobs, particularly in the retail space. You had tens of thousands, if not hundreds of thousands of new workers in the retail space being exposed to processes and procedures, and do they do that the right way? Are we setting those folks up for success and for safety, right? So make sure that they're used in the right way. And then obviously validated with our science certified audit, where we really go in and make sure that the facilities are truly adhering to, the core principles of the science certified program. And obviously, clearly, it's all underpinned by information and collaboration with CDC, WHO, FDA, and others. Next slide. And just to give you a little flavor for maybe just call it the depth of the program, these are just all of the categories that we actually dig into and certify customers against for the science certified program. So again, really looking at those buckets on essential public health practices, food safety practices, and then I just call it maybe the emerging areas of the healthy spaces, right, where you talk about HVAC and air quality, common areas, high touch, fomites and things of that nature. So again, it's a fairly comprehensive, pretty rigorous program. Just want to give you a flavor for all of the aspects that we're going out and working with these customers on. Next slide. And obviously, we want to make sure that it's delivering against the expectations. And these are just some statistics that we pulled from a research study that we did, where we went out and actually surveyed QSR customers, right, quick service restaurant customers, right. They miss their in-dining experience. Clearly, the drive-through was king during COVID, but they missed the dining rooms. But they also really are very focused on cleanliness, and they're very focused on how businesses respond to COVID-19. I think there's a lot of reputations that can be enhanced by the way that organizations have dealt with the pandemic and will deal with, we'll just call it the post-COVID, standards and experiences. Next slide. And so what that means for restaurants, again, as we talk to our customers about, science certified and how they can leverage the program to get folks back on premise, to get folks back in the schools, to get folks back in the facilities, again, it shows that it can drive, based on our survey results, increase in restaurant visits where consumers will feel safe, coming back to in-restaurant dining. And it also shows that it improves brand perception, right? That they understand that those brands that have invested and committed to the seal, that they take it seriously and that it really does truly enhance their brand. And I'd say where we continue to see this program providing value and evolving is even beyond the restaurant and hospitality space. I know one of the things that we saw specifically in food retail and continues to come up in conversations is leveraging the science certified program and concepts to make sure that associates and employees feel safe returning to work, right? So again, I know this group that's on this WebEx is very focused on that topic. And so we've seen great interest for return to work strategies to go in and certify office buildings, to certify higher ed facilities as we talk about return to campus, right, or return to classroom efforts. So our facilities group has done a great job of working with some, very large, prestigious, building service contractors that do a lot of the contract cleaning in some of these large, office complexes to really make sure that they've got the right tools available, the right information available to create that healthy and safe environment for folks that are returning back to the workplace. So again, I think Science Certified is a great example of how our industry is working hard to try to get folks comfortable going back into restaurants, back into hotels, and really getting back to that normal that I think we're all looking for. And I believe that is the last slide that I have. There you go. So again, thanks for the opportunity. Appreciate it. Again, proud to be a partner of this event and proud to have operations in the state of North Carolina. And many thanks to the Chamber for the opportunity.
Thank you, Adam. Now, I would like to introduce Doug Blizzard with Catapult. Doug is the Vice President of Catapult Services, which provides HR products, technologies, and healthcare disruption to thousands of local NC companies. Catapult helps companies address their biggest workplace challenges and creates exceptional workplaces. Leaning on almost 30 years in the HR industry, he also guides members on a range of topics, including talent attraction, culture, leadership, healthcare, retention, and HR business strategies. Doug is also a frequent speaker at conferences and events and a published writer in the HR and talent spaces. Doug, the floor is yours.
Well, thank you so much. And I too welcome the opportunity to continue our partnership with the Chamber and to speak to you all today about a topic that's really affecting every employer. If I had to answer the question, I was just reading the title of this session, which is, how has COVID-19 changed the workplace? I'd probably say two things. One, I think it's amplified shifts that have been going on for about 10 years. In some respects, it's amplified those shifts in the workplace. In other ways, it's masked it, M-A-S-K-E-D, masked it. And I'm going to talk to you today. We as you are fully aware, the last 15 months, we've spent a lot of time in the HR space talking about compliance and safety and FFCRA and PPPs and ERCs and CDCs and OSHAs and masks or not masks and 6 feet and 3 Ws and all that kind of stuff. We've been busy in the HR space for those employers that have been working trying to make our workplaces as safe as possible. And now that we're talking about reopening or returning, same stuff. We're talking about masks again. Do you wear masks or not? Even if you're vaccinated, how do you do that? And I've got some data to show you on that in a few minutes. What about vaccines? What about customers? How do we handle customer issues? Unemployment is probably one of the things that's masking some trends. And so I'm not going to talk too much about the safety protocols, but I think our final speaker is going to hit on that some. So I'm going to spend more of my time talking about what I see as a significant, I kind of call it a seismic shift that has been happening in the workplace in pretty much every industry. And what I'm seeing amongst our thousands of members is, many employers are taking advantage of these shifts and are excelling. A lot of others are not, and they are struggling, going out of business. And so we'll talk about what's driving that from an HR people standpoint. But you think about it, HR always flows always flows from the business. And let's be honest, every industry right now over the last 5 years or so has gone through a seismic shift. I mean, think about Uber if you're a taxi company. Think about Airbnb if you're a hotel. Think about Amazon if you're a big box retailer. Think about healthcare, the tremendous rise in telehealth, and it's getting more and more and more prevalent. Think about my buddy that sells mattresses, for crying out loud. I mean, it doesn't get more go to the store than that, right? Go to that mattress store and lay around. That industry has been turned upside down with mattresses in a box. Buy that mattress on Amazon, get it in that box. You don't like it, send it back and get another one. Tremendous change in the workplace there and staffing and in how they do their jobs in the mattress industry, the furniture industry, gosh, Wayfair, et cetera. And again, I can go on and on and on, but every industry is facing this, and that is affecting our HR practices. Nobody's immune. Every industry is being affected by this labor issue or the supply chain issue, and that all flows back to HR. So let's talk about that. The next slide, please. Again, happy to be here today. We are Catapult. You're like probably asking yourself, what is Catapult? Who's Catapult? Well, we are the recent merger of CAI in Raleigh and TEA in Charlotte. We serve the state of North Carolina, also South Carolina and Virginia with HR advice, consulting, legal advice, training. We do pretty much everything in the HR space. We're involved in it somehow. So happy to be here with you today. Next slide, please. Okay, so again, I think if I had asked the question, what is the HR's role here? HR, if you think about in the past, tends to err towards consistency. I'll never forget, I was speaking to a large group in Rocky Mount one time, mostly HR professionals. And I asked the question, when it comes to your workplace and your workforce, is it more important to be fair and reasonable with people or to be consistent? And every single HR hand raised their hand and said consistency. I had one person in there who was the chief of police of Rocky Mount. He raised his hand when he said fair and reasonable. I said, will you please explain what you mean by that, you being the one dissenting view here? And he said, well, people are thousands of shades of gray. And if I treat everybody the same, that means I'm treating my 5-minute employee the same as my 25-year employee. Didn't make sense to him. So whether you agree with that or not, you cannot dispute the fact that over the last year or 15 months or so, we have done anything but be consistent. We have been very flexible, very, very much handling things on a case-by-case basis. We're meeting employees where there are. We're rethinking long-held practices around performance management and where, when, and how work is done. Even my companies, I think Adam, I love his phrase, repatriate. I'm going to use that, repatriate the workforce. But even in Adam's case, we've been working the whole time, but except we've got a sizable percent of our employees still at home. And that's what I'm seeing in the manufacturing space. Manufacturers tend to be, we've been working the entire time, but you still got 30 to 40% of the workplace at home. That is a seismic shift. We've been hearing now forever about millennials and how they don't want to work and they want to sit at home and they want to be involved in a social camp. We've all been there. We've all been to probably at least 5 webinars a piece on millennials. Well, what's happened now is everyone is being a millennial right now. We've all kind of got a taste of work from home, more flexibility, and we're not going to be able to turn that switch off overnight or in some cases at all. And so I think HR is really there's seismic shifts going on in HR away from the consistency, have a policy for everything, to more of a flexible, looking at alternative methods. And I think that's only going to exacerbate over time. COVID has forced us to be creative when it comes to our workplace and how we handle work. And, I think as an example, work schedules, before COVID, only about 10% of workplaces had a hybrid work schedule, right? Now, 70 to 80% are considering it and are going to be putting in place a hybrid work schedule. That's a humongous shift. Don't let that go by without spending some time thinking about that. And we'll talk more about that. Again, adapt and excel or retrench and retreat, and it's going to be hard for your company. There is a turnover. There is, according to economists, labor economists, a massive turnover tsunami on its way. So we're going to talk today about how do you kind of tsunami-proof your organization, and we'll get to that as I go. But think about a job like accounting supervisor. or a purchasing agent. You know, go back 5 years, kind of their job horizon for the most part was 30 miles around your facility, right? Think about what it is today. It's the world today. And companies like mine, we've hired two of our last hires were in Chicago, Kansas, Virginia. I mean, we have totally expanded our reach to who we're hiring now. That's going to impact employers everywhere. That this notion that, well, they're going to stay in their county and work around the county. It's the case for some jobs, but not for many. Next slide, please. All right, so at Catapult, we have a great document. It's on our website, letscatapult.org. It's a reopening checklist. It's a 7-page document. It's full of great information to help guide you. If you're now starting to think through reopening from an HR perspective, this is a great place to start. Here's kind of the headings on each section. They talk about, and we've experienced here at Catapult with our 80 or 100 employees, there's a lot of work to be done. Even if you've got, you know, some percent already has worked the entire time, there's a lot of work to be done to get your office, to get you got to think through work schedules and all kinds of practices, and you got to think through. So we recommend having a team of people put together to work on that. It's important. It's never been more important to educate employees about a variety of things, whether it be vaccines, of course, going through this, the safety mandates, the CDC mandate. It's important to keep, because there's a lot of rumors out there flowing around. So it's important to keep employees in the know. I want to read this too. We've got one of our sections is assess your employee opinions, and we advise employers to do things like ask questions in a survey of things like, are they either vaccinated or intended to be vaccinated? Do employees prefer to work from home, hybrid, or at office? What changes made during COVID do they want to see continue? Do they want to see end? Are employees comfortable returning to the office? Are there any safety concerns employees like to see addressed? And so again, this will be an anonymous survey, of course, but again, I can feel some people on here cringing from those questions right now. Oh my gosh, we would never ask our employees those kinds of questions. Are you crazy? Who's in charge here? But that's an example, I think, of one of the seismic shifts that's going on right now in the workplace. And we're going to talk, I've got a grid to show you in a few minutes, but this is an example, perfect example of it is important in this day and age to assess where they are. I'm not saying you're going to do everything they ask you to do, but you want to know where they are. Again, avoid that at your peril. Again, a lot of work to do. We address a lot of things in our document here about assessing facilities, a lot to get done there. Work schedule, I'm going to talk more about work schedules in a minute. A lot of work to do there around work schedules, a lot of work. And we're going to talk about some creative things our members are doing around work schedules, even in primarily brick and mortar types businesses. Obviously, if you went through a furlough or a layoff and you had a policy, you want to use the same policy on the way back in, or as Adam calls it, the repatriation. I love that term. I want to use that. But it's also important to review our business and management needs. What this team has got to do is kind of balance all of these objectives and these needs from the employee standpoint, from the facility standpoint, from the business management standpoint. And you will find, as we did at Catapult, there's a lot of options. There's a lot of obstacles to overcome. It's not easy. It's a complicated. And why is it so complicated? Because the world has changed underneath our feet, and not just in the last 15 months. I think it's been amplified in the last 15 months, but every industry, the world has changed. And so a return to normal is just not really possible. I want to make that bold statement, it's just not possible. And obviously, once you get all these various needs identified, then the job, of course, is to work on putting a plan in place. Next slide, please. Okay, so work schedules. Again, I mentioned earlier, 80% or 70% of companies, this is research from Steelcase, who's done a lot of research on this. 70% of companies are looking at a hybrid solution, where it was 10% before. Only about 20% of companies are going to return to normal, if you will, a 5-day work week back in the office exactly as we were before. And about 5% of companies or so are looking at transforming their how they do work, lowering their real estate needs, going to a full-time virtual workforce. That's still the minority of companies. But the key message here, though, is that the overwhelming majority of companies in all industries are looking at hybrid work schedules. Let that sink in a little bit on you. And so if your management team is wanting you back to a 5-day week, we have to do that. We may then think about what that means for your employees, especially for your good talent that has more options today they've ever had. A lot of our members are revising their telecommuting policy. We've got several good samples we can share with you here on how to do that. I've got a member. I will never forget this. We're gonna highlight this member in July in one of our sessions. Manufacturing operation. They've been working the entire time, but about 30 to 40% of their workforce was out, in their office areas, was working from home. Because of just the labor shortage and the labor challenges going on right now, they now have 15 different work shifts. You heard that correct, 15 different work shifts for their manufacturing employees. Why did they do that? Because they wanted to? Absolutely not. Because they had to attract and retain talent. Night shifts, weekend shifts, 8-hour shifts, 10-hour shifts, 12-hour shifts. Very complicated. But what it's allowing them to do, they were confronting a rising turnover issue. So they had to really get creative. And while they had to have their manufacturing employees at work, they can't do that from home. They got real creative in offering another version of flexibility, which is 15 different work shifts. Again, if you want to learn more about that, we got a program in July on that. But that's an example I'm talking about. The world has changed. When I was in HR back in the 1900s, we would have never had 15. Oh my God, are you kidding me? That would have been a disaster. But it's the kind of thing you have to do. And they're also responding to some of your larger name brand companies are now letting employees pick their shift, pick their hours. Again, job sharing is back on the rise, where you let 2 or more employees share a full-time job, and then they get to on their own determine who works what days. Again, sounds crazy. It's on the rise. Next slide, please. This is an example I mentioned earlier about vaccines. What people are doing about vaccines. The slide on the right there is interesting. This is one of our recent pulse surveys of those that are bringing people on site the next month. What are you going to do about about masks? You can see there, and vaccines, you can see there that the majority, 55%. I need my glasses for this slide. Geez, this gray hair is hurting me right now. But you can see there that 55% vaccinated employees can unmask. On the honor system, 15% are going to require proof. So again, most are going to let vaccinated employees unmask. You can see on the left there that most are not going to mandate. Most are going to provide some kind of incentive to get people to vaccinate. So again, I say this for one reason. I lead a couple of different roundtables here, one for manufacturing employers and one for HR in any industry. And when this pandemic started, probably within 6 months into it, most employers were not saying a thing. We don't want to talk about vaccines or masks or no. We don't want to touch that. And that has totally shifted to the other end of the spectrum. We're talking a lot more about these. We're encouraging, as you may saw last week, the Methodist Hospital in Houston won their lawsuit. The employees sued, saying you can't mandate. The judge overturned that. They're mandating. I think we're going to see a lot more employers in the healthcare space start to mandate vaccines. Next slide, please. Okay, so where do we go from here? Last slide, I think an important slide. Where do we go from here? I've got this slide here, and it's empty for a reason. My advice to HR and to management teams is to sit down with a grid like this, and you've really got 3 options. You can return to normal, you can do some kind of a hybrid solution, or you can look to transform and talk about these common HR dimensions here: work schedules, footprint of your office, attracting talent, retaining talent, compensation, benefits, leave. It's important to talk about. So let's take work schedules again. What is our philosophy or strategy when it comes to work schedules? Is it to mandate a return to normal? If it is, then fine. But understand, you're going to be in a minority and you're going to struggle. When I look out there now and I see all these businesses hiring. Seems like every industry is hiring. And yes, part of that is because some percent of employees are at home getting unemployment. That is not the majority. That is not the biggest part of the problem. It's part of it. Don't kid yourself into believing that is once that's overturned. And we're working hard at Catapult with the chamber to overturn that. or to stop those benefits, but still, that's not going to return to normal. You're still having a labor problem. We've seen a fundamental shift in the labor market. Employees have left industries, they're changing jobs, they've gone back to school, they've upskilled, and while we're not probably ever going to see a $15 an hour minimum wage officially, it's kind of happening by default. And so if you're out there paying $9, $10, $11, you are struggling. Heck, many cities now can't find lifeguards. Lifeguards are kids. They're not at home with unemployment. They can't find them. Why not? Fundamental shifts you've got to prepare for. So it's important on all these dimensions to sit down and kind of rate yourself. Where do we want to be on these? I've got some members that are transforming their office footprint. They are going all in on virtual. They are downsizing. I got others that are more hoteling. They're redesigning their workplaces to accommodate, employees working 2 days a week and kind of needing more kind of virtual areas and more areas but not a desk that's theirs or an office that's theirs. So attracting, oh my gosh, we could spend an hour and a half on the new things, the new methods and practices to attract talent today. It's going to take a lot of work for you to really identify alternative labor pools for your industry. That's really what the future is now. Again, we can talk more about that. But again, this tried and true, you put ads on Indeed, you're seeing a lot of companies now putting signs up. I mean, they're struggling. And part of it is because of the shift that's been happening in the labor force and the employees just aren't there for a lot of industries now. So a lot of work, compensation. Oh my gosh, I hear so often from companies, we can't get people to come back to work. They're at home, or we're losing employees. And I ask them, why are you losing them? And I hear predominantly, well, they got poached away for more money. How much more money? 20%. So I asked the question, do you think your compensation is correct? Yeah, we think we're fine. Think about that. If you're fine, then why are you losing employees to compensation? Now is the time to be doubling down on looking at your ranges, looking at your compensation. I've got plenty of examples of members that after years and years of struggling with losing people, they had great training programs and robust onboarding programs and certification programs and apprenticeship programs. They did all these wonderful things, which were great things, but yet their pay was too low. So the people would come through their programs and then leave upon graduation. They've had to invest significantly in just higher pay. So sometimes the answer is right there in front of you. Same with benefits and same with leave. So I think my advice here is take a snapshot of all these areas, and each area right now requires you from an HR standpoint a different look at this, a different perspective. And if you do that and can get your leadership team to look through that new lens, you'll have success. We've got plenty of examples of success. If your objective is to go back in every category to the first column here, return back to exactly the way it was, you're going to struggle. And I'm at 20 minutes. So I'm going to stop right there, Janelle, and let you take it back over. I've enjoyed talking today. Happy to answer questions. It's an exciting time in the HR space, but it's also a challenging time with the fundamental changes that are happening right now.
Thank you, Doug. Now I'd like to introduce Starsky Martin from the North Carolina Department of Labor. Starsky is a safety professional with a background in safety, health, and office ergonomics. Compensation administrator for the North Carolina Department of State Treasurer. He served 2 terms on the North Carolina's Governor's Safety and Health Leadership Council and a member of the North Carolina Safety, Health, and Wellness Planning Committee. He joined NCDOL as a safety compliance officer in the OSH East Compliance Bureau, and then later accepted a position as an OHS Safety Education Specialist in Education, Training, and Technical Assistance Bureau of NCDOL. Starsky, the floor is yours.
Thank you so much, Janelle. Thank you, NC Chamber of Commerce, for our partnership and this opportunity. As she stated, I'm Starsky Martin. I'm an education specialist with North Carolina Department of Labor. Before I even get started, good afternoon, citizens, the community, employers, employees of this great state of North Carolina. All right. My heart goes out to all those that we've lost in this pandemic. I have a heartfelt thank you for all first line workers in every industry. Okay. your jobs are very important. And, you know, together we will get through this, okay? So today we're going to talk about a little bit about the reopening best practices and COVID-19. Next slide. So these are the objectives. We're going to talk about OSHA standards related to COVID-19, employees' rights, filing complaints, and frequently asked questions and additional assistance resources. Next slide. So I want to make mention on some of my slides here, they have our standard that you can refer to in our standard book, 1910-1200, of course, is hazard communication. So cleaning and disinfecting. So the upper right-hand corner of each slide may reference the standard. That's what that number is. Cleaning and disinfecting may require hazard communication program, the increase of frequency. And during cleaning and disinfecting may expose employees to hazardous chemicals. These increases can exceed normal household use criteria. If workers are exposed to hazardous chemicals, employers must comply with the hazard communication standard. Next slide. So this standard requires a written hazard communication program, safety data sheets, formerly known as MSDSs. Now they're not material safety data sheets, they are safety data sheets, labeling, employee training, and inventory lists. Next slide. I'm going to talk about personal protective equipment. PPE must be provided to employees exposed to the hazardous chemical. All right, that's a part of 1910, so part I, personal protective equipment. And that's a picture of a filter-faced respirator there. Next slide. So other applicable PPE standards relating to chemical exposures is 1910-132, general requirements, a written certification of hazard assessment, training. 133 talks about eye and face protection. You need that. You need respiratory protection. As you just saw, a respirator with a mask with a filter there on the previous slide. Hand protection. You need the right gloves, the right PPE to do the job. Next slide. Sanitation is key, especially during this pandemic. And that's the standard 141. All places of employment shall be kept clean to the extent that the nature of the work allows. All right, lavatories available, provided with hot and cold running water and soap. There's a violation of standards, not there. Washing facilities, maintaining a sanitary condition. Common drinking cup and other common utensils are prohibited. All right, food service facilities and operations should maintain sound hygienic principles. Next slide. Medical services and first aid, 1910-151 standard, where the eyes or body of any persons may be exposed to injurious corrosive materials. Suitable quick drenching, flushing facilities shall be provided. These facilities shall be within the work area for immediate emergency use. Bleach used as a disinfectant is a common example. Next slide. Bloodborne pathogens, standard 1910-1030. Applies a reasonable anticipated occupational exposure to blood and other potentially infectious materials. Standards does not apply to respiratory secretions that may contain a virus unless visible blood is present. Provisions found in the standard may be provided helpful guidance in controlling some of these sources of virus. Next slide. Bloodborne pathogens, continuing. So this standard requires a written exposure control plan, engineering and work practice controls, employee training, PPE, personal protective equipment, and medical surveillance. Next slide. Exposure and medical records, which is the standard 1910-1020. Employers shall ensure that access to employee exposures and medical records are provided in a reasonable time, place, and manner. Medical records need to be maintained for plus 30 years. Exposure records maintain 30 years, okay? Next slide. The general duty clause, all right? When we don't have a standard for particular violations, the general duty clause, that's what's gonna be cited, all right? So it's recognized as a recognized hazard. It's a standard that is for a recognized hazard that can cause death or serious injury or serious physical harm. Each employer shall furnish to each of his employees conditions of employment and in place of employment free from recognized hazards that are causing or likely to cause death or serious injuries or serious physical harm to his employer. Next slide. Record keeping. COVID-19 is a recordable illness. Employers are responsible for recording cases of COVID-19. If it's a confirmed case, it's defined by the CDC and Prevention Center. Is it work-related? Defined by the standard 1904.5, and it involves one or more general recording criteria set forth in 1904.7. Next slide. You must report, record keeping continuing, 1904-39. You must report any work-related facility within 8 hours, work-related fatality within 8 hours after the death of any employee as a result of a work-related incident. Any inpatient hospitalization of one or more employees within 24 hours as a result of a work-related incident. You must only report the fatality if the fatality occurs within 30 days of the work-related incident. Or an inpatient hospitalization, you must only report the event if it occurs within 24 hours of the work-related incident. Next slide. Employee rights. All right, you got to receive information and training on the job hazards in your workplace. Raise a safety or health concern to your employer or us, North Carolina Department of Labor, Occupational Safety and Health Division, OSH Division. Report work-related hazard included COVID-19 to us, okay? And on our website, we have a plethora of information, NC Labor, labor.nc.gov, all right? Check their website out. It's got all kinds of communications for you. We got some templates that you could use. You can make it your own. And we even have our COVID-19 page. I think I'm getting ahead of myself. Next slide. Filing complaints. All right. You need to file a complaint. You believe you're working under conditions that are unsafe or unhealthy, and you need to report hazardous conditions at your work site. Give us a call at our Occupational Safety and Health Complaint Desk. It's kept confidential. All right. You can request that your name not be revealed to your employer. All right. File it online, or you can call that number right there, or local 779-8560 or 1-800-NC-LABOR. Next slide. So frequently asked questions, like I said, we got a COVID-19 page. It has about 30 plus, maybe 26 plus questions and answers there. It's probably one of those is your questions and with the answer to it. But it talks about vaccine related, recordability mandated. We just talked about that briefly previously. Co-workers test positive. Yes, your employer is required to tell you. Face mask mandate. Yes, the executive order has been amended, and if you've been vaccinated, in some places you don't have to wear a mask, but it's up to your employer. It's at their discretion. If they state you still have to wear a mask, you guys still wear a mask, even if you're vaccinated. So, reporting requirements for COVID-19. You know, if it's a fatality, then you have to record that on the OSHA log. Next slide. So again, free resources, A to Z topics on our website, which standards that apply. We got, like I said, a plethora of publications. We got our consultative services. You can reach out to them. We got our standards department. You can reach out to them if you have questions about a standard, questions about whether the GDC is applicable, general duty clause. Just reach out to us. We're here to help. Next slide. We got free, like I told you, free example programs, PowerPoints. We got online training calendar where you can request virtual training like this. In-person training has been suspended, but I think we're getting back to the momentum of that. We're starting to reopen slowly. So in-person training may happen, but we've been doing a lot of virtual training. And guess what? It's free. Streaming video services. We got a great library. You can check out resources there. And of course, request outreach training as well. Next slide. So additional guidance, you got COVID-19 Information Hub, our COVID-19 page, like I kept talking about. DHHS also has a COVID-19 page. So go check all that great information out and comply. Next slide. So in summary, this is what we talked about real brief. OSHA standards related to COVID-19, employee rights, filing complaints, frequently asked questions, and additional assistance and resources. And I just like to add, you know, afternoon motivation. I want you to say this to yourself. My job is important. I will work safe. I am an investment. I am an asset. Safety starts with me. North Carolina Department of Labor cares about you. We're not just a regulatory body. Next slide. We're here to help you, okay? I've enjoyed you all. I've enjoyed myself. This is great. A partnership with NC Chamber of Commerce. We really appreciate the opportunity. At this time, there's no questions for me. I will hand it back over to Janelle. Thank you all.
Thank you, Starsky, for sharing your insights. There actually is a question for you. So,
Okay.
Let's see. How does the recent OSHA emergency temporary standard impact non-healthcare employers?
Okay. Well, I don't want to misspeak, so I'll be glad if you will, this person has asked this question, if I can do some further research, and he can email me at starsky.martin@labor.nc.gov this question, and I'll get him a written response.
That's great. We'll put that in our recap.
Okay.
Thank you.
Thank you.
Starsky. Yes. Okay. Are there any other questions? Please feel free to submit a question using the Q&A box. We'll wait a few moments, see if anything comes over. All right, we'll wait a few more moments to see at least two, maybe 2 or 3. But if you guys have any final thoughts, we can definitely head to that, and then we'll see if there are any questions that come in. So we can start in that same order: Adam, Doug, and Starsky, if you have any final thoughts.
Yeah, I think just for me, again, hats off to the other presenters, Doug and Starsky, great material. Love to see the evolving HR space in particular. I agree with you, Doug. It's very dynamic, and I know it's created a lot of challenges and also opportunities, I think, for HR professionals across the U.S. as we've tried to balance the needs. And I really love the questions that you pose to the workforce, right? How you want to talk about, what needs to stay, what needs to go from some of these COVID learnings. So that's fantastic. And obviously, Starsky, your message, on associate safety and really, kind of adhering to the protocols that are out there, I think kind of reinforces that whole kind of audit component, right? And are you really evaluating your work sites to make sure that you're adhering to these kind of changing protocols? So I love the resources that the state of North Carolina has made available. So fantastic stuff.
Yeah, I agree with all that. I guess I would just say, again, if you're finding yourself difficulties, you can't find people, you're losing people, I think it's time to take that last slide I put up and start asking yourself, are we victim of, is it just the current environment, or we have a few significant changes happen in our industry that we've got to get up to speed on? And typically that's what I find is the issue that we, and COVID is kind of, and in some it's masked some things. I know when I go down east a lot, the typical response is people don't want to work because they're getting unemployment. And while that's part of it, that's the minority of it. I mean, there's a bigger thing happening. I just encourage you to notice that, analyze that, and then apply different practices as you return to work, or it's going to be very frustrating and it's going to be a struggle if you're trying to go back to the same old the work forever. It's kind of upside down now in a lot of ways. So yeah, again, thanks for the time, and happy to chat further if anyone wants to go further on that.
I third everything that was commented. You know, COVID, some positive things have came from COVID. It's allowed employers to think out the box, make alternate means of work environments. It's allowed them to expand their resources. And it's also, it's keeping them accountable as well, keeping their employees safe and working. We want you to be productive in your work. We just want you to do it safely. That's all. Just take the right steps to do your job safely. You know, it's everybody's responsibility. So thank you again, NC Chamber, Doug and Adam. Thank you both. Janelle, thank you.
Thank you. Thank you, Adam, Doug, and Starsky. And thank you all for attending today's Return to Work, How Has COVID-19 Changed the Workplace webinar. We hope you found today's content valuable. As you exit today's webinar, you will see a brief survey. We would appreciate any feedback you can provide to allow us to improve these sessions. Again, the recording of today's webinar will be made available to you within 24 hours of the webinar on social media and in the member newsletter. Thank you again for being with us today, and most importantly, be well and be safe. Thank you all and have a wonderful day. Take care.